Hello, my friends, and welcome to the Pathway channel. Today, I will discuss with you the acute on top of chronic cholecystitis. So in this slide, we'll have the whole thickness of the gallbladder wall. But before starting, just a few points about the cholecystitis. So it happens more in females or the female sex with a ratio of 3:1 to male sex. It's usually associated with obesity, hyperlipidemia, and the gallbladder itself may have either radiolucent cholesterol stones or radiopaque pigment stones, or it may be a calculus. The risk factors for having chronic cholecystitis or acute cholecystitis is biliary infection. It can also be anything affecting the gastrointestinal bile salt absorption. On the microscopic picture here, this is the whole thickness of the wall, and you can feel that it's a bit distorted, the architecture, because of the severe inflammation of this wall. And from the low power, I hope you can see this fine dots, which are all like inflammatory cells, and we will go on a higher power to see them more. I want to show you also on the low power here a feature of chronicity, which is the presence of these sinuses, which we call Rokitansky-Aschoff sinuses. These are just herniation of the mucosa inside the muscle layer. So these are the Aschoff sinuses, and this is sign of chronicity. So that's why we mentioned or we diagnosed this case as acute on top of chronic. Let's go on higher power. So this is the higher power, and as you can see here, the whole wall is affected by this inflammation, severe inflammation, even at the serosal or subserosal surface here. It's all affected by this inflammation. And once we mention the inflammation, we can appreciate here also this gray layer here, which are the fibroblasts. They will mature to be fibrocytes to just surround this inflammatory reaction that is going on. So these are gray bundles of the fibroblasts, and these are the mature fibroblasts, which are the fibrocytes. So this is again sign of inflammation. It's going all through here. And as you can see, all the layers, we have these fine dots, which we will go on a higher power and appreciate more. This is the muscle layer, the muscle bundles, and these are the Rokitansky-Aschoff sinuses that we mentioned on the low power, and it's herniated here. It's at the muscle bundle. It should be at the top, or it should only be, the glands should be present at the top, but now it's herniating into the muscle layer, and this is sign of chronicity, as we mentioned. And all through here, we have this severe inflammation. Let's go at a higher power to appreciate the inflammatory cells. This is the higher magnification, and as you can see here, we have neutrophils. These bilobed cells, they are neutrophils, which is sign of acute infection. And we have also some plasma cells around, which indicates chronicity. But as you can see, I will just go with the higher power through the whole layers. You will find that at any place you will have these severe inflammation or these neutrophilic infiltrates and other chronic inflammatory cells. It's all present all through the wall. So in this case, this is the muscle layer. It's all infiltrated with the same cells. And this case was diagnosed as acute on top of chronic cholecystitis. If you like the video, please subscribe to the channel and press the like button. Thank you.